what is fibromyalgia?
Well, fibromyalgia, it's a disease process that involves pain in multiple parts of the body, usually what we call soft tissue, meaning the muscle, ligament system of your body, that it's also associated with other comorbidities such as depression, anxiety, sleep disturbances, eating disorders, etc.
I know there's this misconception that, oh, it's all in your head, fibromyalgia isn't real. When you hear things like that, what are your thoughts as a physician?
Well, I don't think it's in patient's head. I do think, and there's evidence to it, that it's overdiagnosed.
Okay.
So whenever a patient goes to a primary doctor and says, oh, all this hurts, they get labeled, oh, you have fibromyalgia, as being the first option.
Right.
Fibromyalgia is what we call a diagnosis of exclusion, which means you need to rule out all other possible
before you can say it's that.
Before you can say it, because fibromyalgia, it cannot be tested or diagnosed with an image or with a lab work. So you first have to rule out all the possible reasons for the patient's pain before you can call someone as having fibromyalgia.
And some of those symptoms for the fibromyalgia is that fatigue you expressed and that intense pain? Is that what it is?
Yes, it is.
Wow. Now, the symptoms, I've heard symptoms, they appear after physical trauma. Is that true? Or surgery? Or
some people have developed fibromyalgia after surgical trauma, normal trauma, not surgical. Some people have developed after periods of significant emotional distress, and some people just develop it, for no reason.
What are they experiencing?
Well, the most common experience is pain. So these patients will have pain in different parts of the body, including joints, in the upper extremities, in the anterior chest, in the back, in the buttocks area, or in the legs. And then you have associated symptoms in these patients, and they will have like chronic headaches, difficulty sleeping, memory changes, anxiety, etc. It's quite common in some women that have fibromyalgia to have urinary problems or urinary complaints.